Hello everybody, my name is Dr. Hesham Khalil. Originally I'm a physical therapist, then I was quite lucky to move to States 1991, board certified, then have several car accidents where it changed the whole thing. Then I changed career to study osteopathic medicine in Canada for 7 years. Then I decided to expand the work, so start working on research, and I realized after all those years, and then I became the Middle East and North Africa representative for the International Academy of Osteopathic Medicine since 2011 till last year. Today I'm here to tackle a subject which most of us do not really understand or not maybe believe in it, that the connection between body and mind and emotions. The largest two questions in the universe, what happened before the Big Bang and what happened behind our eyes and our brain. Our brain messes up our life all the time. Do you know that emotional trauma can be just as damaging to your body as the physical trauma? Our bodies have the way of speaking the language. Ignoring this language will actually lead to a physical and emotional trauma. According to American Psychological Association, untreated emotional trauma can increase the risk of chronic physical condition by 50%. It's not 10, 20, it's 50%. According to a study of Journal of Psychosomatic Research, up to 80% of patients with chronic pain condition have a history of significant emotional trauma. World Health Organization reports depression, often stemming from unresolved trauma, is a leading cause of disability worldwide and is strongly linked to physical health complications. According to a systemic review published by JMA Psychiatry, emotional dysfunction are associated with alteration in the brain structure. It changes the brain structure and the function, contributing to increased susceptibility in chronic pain condition and musculoskeletal disorder. What is emotional dysfunction? Disruption or imbalance in emotional regulation, including symptoms as anxiety, depression, and stress. What is osteopathic medicine? Osteopathic medicine is a model of medicine of healthcare that aims for the relationship between musculoskeletal, the integrity of musculoskeletal and its relation to other body. It's a system. Doctor of osteopathic medicine uses traditional model and manual hands-on technique with the aim to restore the normal healing process. There is a historical background. Osteopathic medicine was founded in the late 1900s, the 19th century by Dr. Andrew Taylor Still. Dr. Andrew Taylor Still believed that musculoskeletal system is an integral part of the body, and any alteration with this system will affect other body functional and organs, and that which is actually lack of that integration will lead to lack of recovery and disease process. In order to understand the concept in osteopathic medicine, we call it the stages of health. Means we don't get a heart attack all of a sudden. Actually, as a matter of fact, our body first stage is try to adapt the problem. Like if I fall, if I get injured, car accident, then I get, like in Egypt we call it get salima. So there is no such thing. You've been through a force and it will be okay. The body tried to adapt. The changes happen as a result of either emotional, physical, chemical trauma for some period of time. Then what happened after this? The body starts to compensate. When the body is unable to compensate anymore, it goes into what's called somatic dysfunction. Somatic dysfunction means body framework. This is the beginning of pain. We're talking about musculoskeletal, it's the beginning of the back pain. Most of the patient comes to me, they tell me like, I just had this neck pain last week. This is not true. This has been ongoing for so long, to the point where the body unable to handle that stress anymore, then the body start to give you messages. Hello, this is like the beginning of the first adaptation. What happened after this? The body start to decompensate. Like this is the beginning of disease process. Then what happened after this? Tissue changes, which is turned to liver cirrhosis, heart attack, whatever happened to the tissue on the tissue level. There is a historical event happened in 1918 with the Hispanic flu, H1N1. 100 million people has been died or killed by the virus. But it was significant for osteopathic medicine because the statistic at this point in the, this is before the antibiotic, the statistic out of the recovery rate or mortality rate, let's call it, out of hospital, traditional hospital versus osteopathic sanitarium at this time, like 0.5% was like able to live. Like every 100 person goes to the hospital, half person survive, versus 50% survival rate out of osteopathic sanitarium. That actually, the lesson been learned that during Roosevelt 1947 recognition of osteopathy as a full licensed physician in 10 states. Then after that 1960 all 50 states recognized DO as a full licensed physician. There is some principle in osteopathy which will actually make you understand the concept in a more broad way. The first principle, osteopathic physician believe that the body is one functional unit. Body is like physically, like body, mind, and spirit. This is the only medical model which believe in the three components. Also, it relies on the relationship or interdependency between a structure and function. Structure here means anatomy, function means physiology. So when the osteopath checks someone, it's in his mind what happened in the relationship or the interdependency between structure and function. What happens between the anatomy and physiology. Anatomy and physiology, the way we been taught is like anatomy is one thing, is a one branch of medicine, physiology another branch. In osteopathic medicine, the hard part of it that we study osteopathy as physiology and anatomy as one integrated model, and they are interdependent on each other. Body-mind unity, the osteopathic medicine believes that we are one piece, we are one functional unit, and the self-healing takes place as soon as we start integrate to within ourselves and what's happening around us. The mind-body connection osteopathy have three models: neurovisceral integration, emotional well-being, and stress response. I will go through because of the time. What osteopathy do? Let's go scientific evidence better. According to JMA, the use of osteopathic manipulative treatment as an adjunct therapy in children with recurrent acute otitis media, it actually, the sample was 57 to 25 were treatment group, 32 control intervention patient has fewer episodes of acute otitis media, fewer surgical intervention, more surgical free months, increased number of normal tympanogram. There's another big research happened in the 2013 in a surgical hospital where a group of people has been received osteopathic medicine, osteopathic treatment, versus another group. The one have received osteopathic treatment or OMT has actually better response, better recovery in almost like half of the time. According to JOA, Journal of an American Osteopathic Association, increased lymphatic flow in thoracic duct during manipulative intervention. We have many actually research. American Osteopathic Association has published article highlighting the effectiveness of osteopathic principle in addressing both physical and emotional aspects of health, emphasizing the importance of treating the whole person after rather than just symptoms. How this work? Through a process of diagnosis and treatment. Diagnosis, usually it's a process we do like just traditional diagnosis, like if somebody comes with pain, we take history, look at the x-ray, MRI, imaging, ask family stuff, then we do what we call it physical evaluation. Like we check the musculoskeletal integrity of this person, then we try to find out where is the root cause. Treatment-wise, also we do the same thing like traditional doctor. In addition to that, we use manual skills like stretches, techniques, like manual technique. Do we have OMT here stands for osteopathic manual treatment. We have several things like which is unique about osteopathy, that we can use soft tissue techniques like myofascial release and muscle energy, as well as what's called cranial osteopathy or osteopathy in the cranial field, where we mobilize the cranial structure. There is many research on that as well. Do we deal with pain and aches? Of course. There's mobilizing the body with the flexibility, relieve that tension, improve the circulation, definitely will help the pain and aches. There's many case studies addressing this emotional, like body ache connection. Okay, how this happened? There is two ways of this is to happen in our body, either direct or indirect. Direct, if somebody get a bad news, what happened? They may have a heart attack, right? This is a very straight direct, what happened in the mind. There is the other way, it's a slow, indirect way of having the stress or continuous stress in our body. And this is the best way to explain that. We call it HPA axis, hypothalamus pituitary adrenal axis. What happened to us when we are stressed or have seen something like we don't like? Let's say if you are not good with dogs, how you feel when you have dog in front of you? Your blood pressure increases, your heart rate increases, your respiratory rate increases, you may get sweats and so forth. This is sound like small thing, but it happens on the long run. It like a little piece of like a drop of water, but if this drop of water keep going all the time, it can actually make a hole in a stone. Why osteopathic care? Because it's a holistic approach, patient-centered and integrated of mind-body techniques. It works both ways. You can treat the mind first, it works. If you can treat the body, it works. I have a dream of having integrated model, like where everybody work together, I hope, and embrace the differences. And that's why actually I'm here today. Importance of holistic healthcare, it helps patients. It said, okay, so, okay, that's almost right on time. To conclude, osteopathic medicine offers evidence-based strategies for addressing emotional dysfunction and alleviating body pains and aches. Osteopathic medicine approach restore health without the need of medication, natural homeostasis. Thank you for listening, and if you have any question, we'll do it later maybe. Okay, thank you.